Medicare, paid. There's a huge difference if you have PPO. You know, you're going to pay negotiated rates with providers, with the doctors. The people who pay the most in the insurance market are people who are uninsured because they pay rack rate. You know, they pay the rate that the provider also hopes someone will pay them in the best of all worlds. But you know, insurance companies have to go, and Medicaid and Medicare all negotiated these very, very negotiated rates. So it's hard for you to figure out what your medical care costs because you get your bill, and then I'm going to show you the next slide is like just a Medicare bill, showing you really how different what the charge of Medicare reimbursement is. So we really don't know. And then prices vary, like CT for Medicare is different than CT for Medicaid versus individual health care versus CHIP. There's no whoever the payer is. And even within the group of health market, that might get a better rate than Cigna because they're going to negotiate. So it's insane. This is just an EOB from Medicare. This is mine. I had an emergency room visit. The hospital charged me $3,700. And Medicare said, okay, well, we only pay $500 for that. You know, that's what our rate is. And then, you know, I have my co-insurance. So $399 is what that provider got paid for an emergency room visit. And that's not atypical for providers to be reimbursed at 10% of what they charge. Now, where they come up with their fees, I don't know. That's also a mystery. We don't know why the providers have the fees they have. But so let's look at what some typical fees for exchanges and what's happened since the ACA. Okay, in 2016, I went back. You can get all this on Kaiser Family Foundation. You get all these calculators for what premiums were in different years, different states, different age groups, demographics. So in 2016, I kind of just set up this hypothetical person, average, getting a silver plan, kind of an average person getting an average plan, and that person in 2016 would have paid $321 a month for their premiums for an individual, and their family coverage would have been about $833 a month. And I remember that. I remember that's about what we were paying for my daughters. And then, of course, the other thing on a plan is, well, what is your deductible? On a silver plan, 70%. They pay that. They pay 70% after you've met your deductible. You're all familiar with this, obviously. And then you have a maximum out of pocket. So the maximum deductible and out of pocket expense in 2016 was about $4,300 for an individual, and $79,000 or $8,000 for a family. Probably familiar with how these plans on the exchange work. There's different metal levels. You got silver, gold, premium, catastrophic, platinum, and those are all priced at different tiers because they pay higher benefit based on the more precious the metal. And then it's also, and according to ACA, you can only rate two ways. One on what tier you bought in, and three, there were some, or two were some ages. So they had age brackets, people at 18 to 24, 25 to 34, etc. So there, as you got older, it did cost you a little bit more. If people, 55 to 64, you pay the highest premiums for one Social Security. So in 2017, that same individual family, the rates went up 22% to $393 a month. This is your average, this is average whole nation. And out of pocket was the deductibles would be $4,700 for that same individual, and that was up from 2016 as well. The premium was up by 22%, but the composite deductible was only up 1%. Families paid an average of $1,021 a month, or $12,252 per family in 2017. And then on top of that premium, $88 $8,400 in your out-of-pocket and your deductibles. So it's expensive. It's very expensive. And the markets were reacting to the fact that they were a market. I'm talking about this, this is the exchange market. And they had not underwritten some of these things properly. There was some uncertainty about what was going to happen in certain markets and geographic areas. But this year, the markets finally stabilized in about July of 2017. So the markets were stabilized. The insurers were getting ready to get their rates together for 2018. And then this happened. We got this executive order in the fall. And the president stopped what's the cost savings ratio of payments to the insurance companies. Part of the ACA was that you have to provide, insurers had to provide a certain level of affordable plan at the silver level that people could afford. And the government would give them a check for that. They were paying it. And the Supreme Court, that case that tested the ACA, kind of said, well, ACA is legal, but those payments to the insurers are kind of discretionary if you want to be really, really technical into the individual mandate as a tax. So Trump said, I'm not paying those CSRs to the insurance companies anymore. The insurance market went berserk. Berserk. That happened in October, right as the premiums were being set. That happened in September. Had huge impact. Rates immediately went up at a minimum of 12%. As a matter of fact, some states require that insurers raise their rates with the thought that he might do this. So we had another jump in rates. Then the individual mandate was tossed around as a possibility for repeal. So the bottom line is, for anybody who's buying insurance this year, it's atrocious. The premiums are up 28 to 44%. I know in my family we're looking at 45% increases. And not only that, the plans are worse. The networks, they decided to lower the networks. I know in Michigan now we can't leave the state to go see the doctor. In Indiana or Illinois because we need to shield plan, because you can't leave the state, we're not paying. So it's a very, very bad year. And that's without what's happening right now, which is removing the individual mandate tax, which essentially eliminates the individual mandate. We'll get to that. So in 2018, I said the costs are way up across the board. The same family, the same individual has an average, and this is national. The rates are up 34%. The range is from 22 to 48%. And the price increases are going to be felt by probably people like you in this room who are not on Social Security, yet Medicare, who are paying or buying an individual plan for yourself or a family member on the exchange, because you're not eligible for a subsidy. And unless you can get a subsidy, you're going to be hit with the full impact of these aforementioned shenanigans. So, I know I said I would try to find something positive about that. Okay. Yeah. We'll just, at the end, we can put our heads together. See if we can find a silver lining here. We're going to be smarter. Okay. So in order to get these subsidies, how are you eligible for a subsidy? Well, you have to be at a certain level of the poverty level. And please remember this. The ACA said that the Medicaid expansion would include people who could now be eligible for Medicaid if they were 138% of the federal poverty level. So the federal poverty level for one person is $12,000. 138% of that is $16,000. And if you you get a subsidy. Okay? So, but if you earn more than $48,000, you're not eligible for a subsidy. So that's why so many people like us are being hit so hard. But if you make less than 48,000, you can get a subsidy, or if you make below the federal poverty level, you can get Medicaid. Or if you make $16,643, you're eligible for Medicaid. So for Medicaid eligible folks, it has really put a lot more people onto Medicaid and gotten their health care. But again, you can see these tweaks. So in Michigan, for a family of 4, is getting a subsidized plan. They are 328% of the poverty level, so they're eligible for subsidies because the threshold is 400% of the poverty level. So this family of 4 is going to pay $646 a month for their premium, or $7,700 a year. The law says it can't exceed more than 10% of their income. So it does not. Their health care does not. So they're eligible for the subsidy. Now that $646 includes the $228 that family got as a subsidy because they are eligible, because they're below 400% of the poverty level. If they did not have that eligibility, they'd be paying $874 a month. So if you look at the slide, if we add up 228 and 646, that's 874, I think, and that's just how the math works on it. So now, even with, we're going to get to this, even with what Trump did with the CSR, this family's not going to pay any more for premium, and I'll show you how and why. So that's their silver plan. They're going to pay $7,700 a year, and with their deductibles, because they still have deductibles, it's a 70-30 plan. They still have to pay their co-pays, and still have to pay. They're going to pay about $15,000 a year. I'm sure. Premiums, if they have medical claims. So again, healthcare is expensive, very expensive. In 2018, the same families, let's just go back and look at this here. So $646 they're paying last year, okay? Now this year, they're going to pay about the same, $637. Now, Trump got rid of the CSRs, right? So, okay, he's not going to pay those. But the law says that the government has to subsidize premiums for people at this income level. So they get that in increased tax credits. They get an increased tax credit. So now, government, they're not saving money by getting rid of the CSR. All they're doing is trying to put a squeeze on and trying to kill the ACA. But the federal government is not going to pay any less because of this elimination of CSRs. Because now this family is going to get, instead of last year they got 228 in subsidies. Well, now the government's going to pay out of their premium of $7,648 a year. They're going to pay $662 out as opposed to 228, because there are 2 parts to how people get subsidized on health care. One is a tax credit, and the other one is the CSR that is paid to the insurance companies to make the plan more affordable. So if you're buying this plan, unsubsidized plan, and you didn't meet the income level, you'd be paying $1,300. You'd be paying $1,300 a month. They still would have their $16,000 out-of-pocket deductible expenses. So insurance is expensive, health care is expensive. Now let's look at the biggest consumer of health care, and that's the insurance, the employers. So what do employers pay? They buy more health insurance than any other sector. So for this same family of 4, they don't care what your income is when you're getting a policy on group health. Your income is irrelevant. The employer's paying the premium, and you're paying part of it as an employee. So the average cost in 2017 for a family of 4 was $27,000 to insure a family of 4. But this is kind of average, but it would include all the really good gold Cadillac plans that some of the larger employers have, but that's the average. Of that, employees still pay $7,100 in their payroll deduction, and their deductibles, et cetera, et cetera. So employees are still paying. People are still paying. Employers are paying. Employees are paying. So there's a lot of money. As we look towards solutions, think about how much money is floating around here in premiums. So now, why do plans cost so much? Well, why does healthcare cost so much in this country? I don't know, because it costs more here than anywhere else. 17% of our GDP goes to healthcare costs. And we have the most expensive healthcare in the world. You probably can't see all this slide, but just look at the tallest bars, and that says United States under there. And our cost for these drugs is at least twice of what the other 7 countries that are in this study: Spain, Australia, Great Britain, etc. Our cost for drugs is way, way higher than other countries, developed world. Again, look at the bars, the highest bars there, that's the United States. Our costs for MRIs, for CT scans, for colonoscopies, we're higher than anybody else of these 8 countries. Our procedures, again, cost more for hospital day, appendectomy, normal delivery, bypass surgery. Now, Eric sent me a wonderful slide presentation, which unfortunately I couldn't import into mine, and we probably don't have time to meet my technical problems, but some of the reasons why healthcare costs are so high in this country, and we really have to think about that too as part of the overall picture. So, why is it more expensive here? Well, 25% of our costs go to collecting bills, marketing, filing claims, managing. Not healthcare. 25% of the cost. As I said, there's no price for anything. So we have prices all over the place. We have certain providers branding themselves in one way. They charge more because, I don't know, they have a better location, they have a better logo. We have no cost control in Medicare Part D and pharmacy. And medication is probably close to half of what all medical expenses are across the board. So we don't, and there's a reason we don't have that. That was a little deal that was cut when George Bush negotiated the Medicare deal, that, okay, we're not going to touch the pharmacies. And in the next slide, I'll kind of show you what. We do more procedures here. We see more specialists. We just give people more medical care. There's a lot of reasons for that. Intensive medicine, make more money, don't know what we're doing. We have something called siloed healthcare. So you pay one price for a group health employer plan. You pay a different price for Medicaid. You pay a different price for a Medicaid patient. And then they just shift these costs. The providers just shift these costs all over the place. It's like playing a game of old maid. Like who's going to get stuck with the bill, and they try to raise their prices to cover this disparity in prices. So defensive medicine, of course, fear of being sued. Reform is not a bad idea as far as some of the solutions for healthcare. It's certainly not a good thing, but it is something that has been a problem. And then there's something called the lobby. The lobby. And this is an analysis of all the sectors that pay lobbying money. You can go back and get this. Goes back 20 years. Who's at the top? This is just through November 21st of this year. 2 big lobbying sectors: insurance companies and funds. Now, down here, health services and HMOs. The hospitals and providers really, they should get on stick here because they're getting out lobbied by what, like 4 to 1. But this includes every lobbying sector. You can't see the small print here, but this is every lobbying, defense, technology, everybody. They are twice, 3 times as big, pharma and insurance companies. So part of the problem is there. Big part. They're very powerful. All right, so The other part of this presentation is to look at legislation in the U.S. What significant healthcare legislation have we had? Well, Medicare was a big one. Like that, everyone likes Medicare. Medicaid was a big one. Then we had Social Security, disability, and Medicare Part D, the George Bush drug plan. That was an amazing expansion of Medicare. We have the CHIP, which provides insurance to low-income children. Then we have the Affordable Care Act. And then now we have this tax plan, which is a significant piece of healthcare legislation, in addition to being a significant piece of tax legislation. So, are y'all familiar with the provisions of the Affordable Care Act? I don't want to go through a whole lot of details of everything that's promised to you, that was in that, but we had, you can't be denied coverage for pre-existing condition. You have to have insurance. If you're an employer, 50 or more, you have to have coverage for your employees. Kids can stay on their policies till they're 26. There's no lifetime cap. Set up the exchanges, expands Medicaid, and provides these tax credits and premium. And also, these are all the pre-existing conditions, and we all have them. Migraines, diabetes, pregnancy, stroke. So basically, before the ACA, and I was certainly a victim of this, filling out a health history to try to get an insurance policy. You have an interview with somebody, to try to get individual policy.
Just all those are preconditioned. Prior to ACA, insurance companies could deny you for each one of those line items.
Yes, anyone.
Anyone,
and they did. And you couldn't get an individual policy. That's what's so significant about ACA. You now get a policy. And you also the plan has to cover all of these services. Before, you buy a plan, and mental health was never covered, or it was covered at 50%. Pregnancy wasn't. They would put these policies together, but they didn't cover most of the things that people need when they're getting healthcare services. So, many essential benefits were not covered in ACA, and that's a critical thing about ACA. You still have that. If you're getting a plan on the exchange, you're going to have this coverage. And I just want to make a little plug here for how significant it is that we have these. For example, maternity was not covered. I used to have to, when I bought my plans, they say, do you want maternity? Well, yeah, I have 80 nurses working for me. I probably want maternity. But it was optional. Mental health, well, we only cover that at 50%. And, there's a limit on it. You can only have 20 visits a year. So that's how, for now, that's been eliminated. And we have in this country 43 million people have mental health issues. And 5% of our population has serious mental health issues, such as depression, bipolar, substance abuse. And in case you haven't noticed, there's a huge opioid problem in this country. So, fortunately, ACA provides for coverage for these things. How is it funded? I'm not going to go through all of that, but it's funded by taxes, it's funded by penalties on the individual mandate if you don't buy insurance, and I really don't know at the end of this tax nightmare what it's going to look like, what funding there will be for the ACA, because they will start stripping away all these various taxes, the medical device tax, the income tax, the Cadillac plans, the individual mandate tax, and so we'll have to see what that looks like. But it's funded. The ACA was funded. It was actually revenue neutral when it was drafted. What does it cost the government to run it, to have the ACA in place? Well, they have to have the exchanges, which this year they're not spending a lot of money on those, as you know, staff, technology, advertising. One of the costs was the premium subsidies. That'll cost, the CSRs for low-income people. That was eliminated by Trump in October of 17. But again, the tax credits are still in place. So if you're eligible to get subsidies, still get this tax credit. And then the cost of Medicaid expansion, which was a big, cost of, that's what they were, the state cost, but the government said for 10 years they would pay for that expansion. Republicans keep trying to repeal the ACA, and I mean, they're trying as we speak. Why? Well, they don't like mandates, they don't like Obama. It puts some taxes on some people they don't want to tax. It was passed by the Democrats. Now, from the legislation I have seen written, I have to say it is an astounding amount of ignorance that has gone into drafting this legislation. It's appalling that our legislators would put forth, that they have put forth without understanding. A little old person like me, worked in the industry, know what little bit I know, and they're drafting legislation that is so ignorant and uninformed. And that's part of why I'm doing this presentation, is to start informing as many people as I can about the scope of this, because when you see this legislation coming up, you need to know how bad it is and why it's bad and what to say. And the other thing is, I think they're just mean. I really think they're mean. There have been a lot of efforts to replace it, repeal it. We won't go through all of that right now. As of today, the ACA is the law of the land, and they are whittling away everything they can do. As far as driving it, as well as the rest of the Senate and the House, the Republicans. I'm not going to go through each horrible thing they tried to do in the House, each horrible thing they tried to do in the Senate, and how many people were going to be bumped off insurance, because I think we all know that, millions. And I would say also that 13 million people will lose their insurance if this individual mandate is part of this tax bill. That's how many people are going to lose their insurance. So here we are right now with what's on the floor today. And it's not a pretty picture, because of the CBO estimates that 4 million people will lose coverage in 2019, and 13 million by 2027. Many healthy people would voluntarily decide to go without coverage. That's what I have to say about health is, you're healthy until you're not. And you don't know that when you get out of bed in the morning, or when you go to a concert, or you go to church, or you get in your car, or you go to your doctor and you get your lab report. You can't make that assessment. So nobody should be without insurance. But people will opt out in record numbers. So, and insurers will have this pool of increasingly more sick people, and the rates will go up, because they're not stupid. Like I said, they have actuaries, and they know they will adjust their rates. They can adjust their rates. And these premiums will turn more consumers to become priced out of the market. And that's what I'm so concerned about. And that's what I'm seeing, because I think a lot of us are feeling. This tax plan also creates this huge deficit, $1.4 trillion. And as this deficit is moving out there 5, 10 years down the road, when we're talking about, we have this deficit, what's going to be on the chopping block? What are the big things? It's Medicare, it's Medicaid, it's Social Security. And that's how they feel. Are you all depressed?
Yes.
I'm sorry. So, here's some.
Are you serving alcohol?
I'm sorry, but we need to be informed. Here's a bright spot. Here's where we'd like to be. Maybe not now, but single payer Medicare for all. We'll talk about Bernie's plan in a minute here, but we have single payer in the U.S. It's called Medicaid.
Right.
And it's called Medicare. And in those plans, you have providers, and the government pays those providers, and patients get the care, and they don't pay anything for the most part. So we already have single payer in the U.S. in 2 sectors. Other countries that have very successfully done this are Taiwan. They have private providers, and the premiums are paid by payroll tax, And you can buy policies for your out-of-pocket expenses, or in some cases the government pays for it. 99% of their population is covered. Australia has Medicare. I'm going to hold your question because I'm just about done and we'll come back. Australia has Medicare, again, private providers. It's paid for out of payroll income tax, and it doesn't cover prescriptions, so the government kicks in some additional funds for prescriptions. France has Sécurité Sociale. Basically, you get a 70% reimbursement on your medical care, 80% for hospitalization, 100% for maternity. God love those French. And funded by the government through taxes, obviously, and you can buy a little plan to cover your 30%, just like on Medicare, you can buy your plan, to cover the 20% Medicare doesn't cover. Then we have universal health care. Single payer and universal health care are not the same thing. Universal health care would be like they have in Great Britain, where government, the medical providers are employees of the government, and the government pays for all the health care through taxes, free health care paid by taxes. And in the United States, we have that too. It's called the Veterans Association, Veterans Administration. And go in, the providers are through the VA, and it's free health care paid by taxes. So we're not without precedent here. We have some models. Does anybody want to pick up and start thinking about this? We have some. So, is this, I've heard some people say this is the greatest healthcare system in the world. Well, no, it's not. It's not. Huge sector, $3 trillion, but we're ranked 37th in the world for healthcare systems, 11th in industrial nations, 27th for life expectancy. We have the 4th highest infant controlled mortality rate. I mean, this is a developed country. We're not talking Yemen, but developed countries. And we have a likelihood of dying at an earlier age, including cardiovascular disease, than other developed countries. So we pay the highest taxes in the world. Now, you might have heard otherwise, but we do not pay the highest taxes in the world. We pay about $11,000 per citizen. Canadians pay about $14,000. Per capita spending in the United States is $9,000 on health care. In Canada, it's $4,500. So they get higher education, they get health care, maternity leave, and we're in the middle as far as taxes, but what do we pay? What do we get for our money? We get defense. We get $611 billion worth of weapons. That is the combined military spending of China, Russia, Saudi Arabia, France, the UK, and Japan. All of them together. What we spend on defense. And don't spend on health. So, what's happening as far as healthcare reform? Patty Murray and her committee were working on trying to stabilize the markets, this is before, the last month, repealing some of the medical device taxes, letting states have a little more control over their plans, helping to cut the insurance, trying to just stabilize the market. I don't think that's going anywhere. Bernie came out a couple months ago, and he wants to do a Medicare for all plan. And his plan basically would be employers would pay like 6.7% of their payroll for health care. And individuals would be taxed about 2.2% of their incomes for health care. And by providing a Medicare type plan, which would be, we already have Medicare, expanding it, and then, there's lots of details to Bernie's plan. Bernie used a lot of the same research I did on my presentation, so I know we're thinking along the same lines. We look at all the money that's out there in this. If we were to do something about pharmacy costs, if we were to do something about taking the cost for marketing and billing and administration out of our systems, if we were to use insurance companies more strategically to control costs in Medicare, where there's a lot of money out there to fund a national health care program. But the political will is not there, clearly. It's very complicated, very complicated. It's a huge, huge sector of the U.S. economy. There's a lot of players, political, economic, corporate interests. There's no easy fixes. And any fixes require a very thoughtful approach. You have to really sit down. You can't just slap this legislation together like they tried to do this year and last year. You cannot slap healthcare legislation because it's going to affect so many people. It has to be a collaborative process, vigorous public debate, input from all stakeholders. The uprising that we saw about Medicaid shows that, and that's why we still have the Medicaid expansion. People on the streets by the tens of thousands, and the American public is really not going to put up with the healthcare base rate. At the end of the day, it's one of those things that really is a core concern for everyone. So this presentation is just one step to kind of understand it. I'm sorry, it's not better news right now, but it's the way it is, and we won't be able to solve it until people like you in this room understand it a little more, are able to articulate it, until more people understand it, and this is just a beginning to start that process. So, any questions, comments?
Okay. Learning more about this definitely is key. So one of the things that I'm trying to put together in my head is the difference between universal health care and like Medicare health. So can you, like, in short sentences, tell me the major difference between, because obviously Medicare for all is good, except that, there's a lot of people that could be on Medicare. I'm not going to get pregnant, so I don't pay for pregnancy right now on Medicare. If you do Medicare for all,
right.
That's
Well,
product. So there are things. So universal health care versus.
Well, so it's, universal health care is like like Medicare.
That's a universal health.
Yeah, those terms get swapped back and forth a lot,
right.
but universal, it's single payer, and you have individual providers, and somebody, the government is, like Medicare is paying the bills, as opposed to, as opposed to universal, did I say? As opposed to universal health care. The other was single payer. This universal health care is like Great Britain, where the medical providers are employees of the government. So that's kind of a simple definition. And I think there's probably more pushback if we're ever to get to single payer or universal health. There's probably more pushback than having all the providers be government employees. That would be much harder than
So the language varies. Some people do use universal health care this way, but also universal health care is often used in the way you first said, as a synonym for everybody has health insurance. But
there is a difference between the two.
And the coverage that England has, where the providers are employees, is often referred to as national health.
Right.
But I think that's one of the things that we have to get, using our verbiage correctly, we have to not throw them into the same thing because they're not necessarily the same. It might be this kind of same concept, but it's not really the same.
Yeah, like national, that's a good way to put it. And there, and these terms are swapped around so much.
Yeah,
but we're, if we got to single payer, which would be like Medicare, where you have, providers that have a negotiated contract with the U.S. government, would be far better than what we have now, and universal health care, where they're provided by the employees of the government. National health care, let's say national health care and universal health care are the same thing. But universal is a word you throw around because that means everybody gets health care. Everybody gets costly.
Go on. I look at it as the forces that can influence or going to weigh in and push one way or the other. And the insurance industry is a major force. So where is the insurance industry in this whole equation? Do they want it to remain as it is? Do they want affordable health care, ACA? Do they want universal? Do they want single payer? What are they trying to push, or what will they push and or support?
Whatever they can make money at. I mean, they would be happy to continue with the way it is now because they can just adjust their premiums up.
Yeah, but if they address the premiums up, like you said earlier in one of the charts, more people are going to drop off. So that's not
Right.
necessarily a great.
Right. Although the other thing that's happening is then, Trump also changed one of his executive orders. He changed the rules on the short-term policies. You used to be able to just buy a short-term stinky policy to get you through until for 3 months. That was limited. Well, he made that so now you can get it for 12 months, and those policies are horrible. The insurance company, I mean, what is the insurance, or do they care that they lose 13 million customers on the individual exchange, on the individual market?
And so what the profit is way over
Yeah,
here.
it depends on how much money they make on those. I mean, this whole thing is driven by profit. Our healthcare is based upon how much money in the group employer market, in the individual, how much money insurance companies can make when they sell a premium. So,
Would they be able to make money on the single payer or universal health insurance?
well, they would probably be in a different role. They wouldn't, now the federal government could contract with them, they'd be smart to contract with them to pay claims and to write benefit plans. I mean, they have so many resources, incredible data. Really, I'd love to see Medicare use more of the technology in the insurance industry. But yeah, they would be a huge loss of their group health business, their individual. Yeah, they're not going to like this. But there are places for them. There are places for them.
And what would those places be?
Well, claims. They could do claims. They could write plans. They could do risk underwriting. The government could subcontract with these carriers. But again, you still have, these are for-profit entities. It's not going to be as good as if, we don't have the kind of overhead in Medicare that we do with an individual health care tax. So.
What do you think of the Aetna CVS merger that we heard about this week?
I'm kind of processing that. It's an interesting concept. It's not the worst thing I've heard, but I'm suspicious just because of the players. It's an insurance company and a pharmacy.
Yeah.
You can't do it.
Yeah. Yeah.
So, but I mean, at face value, it's an interesting concept that's not been done before. But I'm
The theory is that cost would be controlled.
The theory is.
That's the theory.
Right, the theory is.
But in reality, you don't.
I don't know. I mean, I guess my initial reaction was that it was kind of positive to it, but again, I'm suspicious. There's got to be something evil about an insurance company and a pharmacy.
Something evil.
It can't be good. Yeah.
Just a quick comment and a question. One is, I think all countries that have universal coverage of people who don't have a single payer as the government have insurance companies, like Germany, for example, or Japan. They have insurance companies, but they're all nonprofit, highly regulated.
Mm-hmm.
So, as you mentioned, it's an incredible amount of administrative costs. That's got to be addressed. And one way are those models as well.
Mm-hmm. Yeah, I mean, we could take some of the, like I said, we basically have this giant industry where many, many sectors are making lots of money on our health care. And that's what drives it. That's kind of messed up. It's not good for our health.
So my question is, what do you think about the pressure from Sanders, now others, of healthcare being a right, and should that be pushed? And I think they mean moral right. I've heard some senators and representatives Republican and very much against any type of universal health care, saying, well, no, there's not a right to health care. You don't see it in the Constitution. So they're saying there's no legal right to health care out there. But do you think that it's good to push that there's a moral right to health care? I think, one last comment, I think sometimes they'll say, yeah, well, there is, I mean, if you're dying, you've got to save your life. So in that sense, there's a right to health care. But if you're suffering, no. You don't have a right to be taken
Here's what
care
I
of.
think. I think you have a body, you should have health insurance. You have a car, you have to have car insurance. And however you get to that point, there are lots of ways to do that. But the fact that somebody doesn't have health insurance doesn't mean they don't consume health care services. They go to the hospital here and they stick them on the bills. They get sick, and they go to work and get everybody sick. And then when they get to Medicare, they're very sick. They're very, very sick. One of the things we saw with ACA was people going into Medicare that had that health care, in those bridge years that were uninsured, came into Medicare healthy. So you pay for it somewhere. It doesn't go away. Like I said, health is, you're healthy till you're not. What about those people? I mean, I just keep, when I see these things about these mass shootings, and I go right to, okay, it's 500 people. I know some of those people don't have health insurance. I know it. And they went there, and they had a good reason maybe for not buying health insurance. They came out of there in terrible shape. Their lives, many of them are there. And we shouldn't, that's a very extreme example, but so everybody should, for the good of the country, for the economy of the country, people should be able to get health care.
We're all better.
We're all better. We're all better. And that's what the ACA, was proving. It was making a difference. So, you harm your doctor, you harm your local providers when you don't have health insurance and you go there and you don't, and they don't pay the bills.
So, through all of this, one of the things we've learned as we've gotten smarter about health is the connection between our dental issues and our vision. And so many of our plans, do not have dental and vision. So do a lot of the universal health plans have them?
Not many, no. Depending on some countries, but I mean, for the most part, they're covering,
Is that something that also has to be thrown into the mix?
Oh my gosh.
There is a direct correlation to our health.
Yeah, it is, and I mean, there are ways to address that by having, people buy policies for that, making it available that are affordable. So, yeah, of course, that's all part of it. It's all part of it. But the way I look at it is just prioritizing, that people can get basic health care and catastrophic health care and preventative health care, because that pays off economically.
Why the animosity about the ACA? Why the hatred and stuff? Just because it's Obama?
I don't think that's the only reason. I think that people who make above $48,000 a year are resentful that because the government is subsidizing people who make less than that, their premiums are going up. And many's the person, I've been at the fair in the summertime, who's come into our Democratic Party tent and said that's what they're mad about, that the government is paying money to these poor people who are too lazy to work, and I'm having to pay more. We got to figure out a way to respond to that.
Well, that underlying thing is across issues other than healthcare,
Right.
and that has some racial connotations.
Sure.
The biggest objection is forcing people to buy insurance.
I'm sorry, what is it?
Forcing people to buy insurance.
You should have a right to say, I don't want to be.
I don't. Yeah. That is the biggest objection to the Affordable Care Act. They don't care that they love that you have essential benefits, and that you can't have, that pre-existing conditions are no longer, exclusions, you're getting coverage, and you can have, they love all that. What they don't like is that, you have to buy insurance. Now, I guess I understand that. The only problem is, and this is going to make you really depressed, if you don't have an individual mandate, you can't have these policies that are affordable. And that's why what's happening now, honestly, I was hoping I didn't cry during this presentation. That's why what's happening now is so awful.
There's another component that I think is important for all of us to understand. I have a number of friends who own small businesses around the country, and when the Affordable Care Act was passed, they were complaining about it. And I said, well, what's the issue? Okay, and the issue is they're a small business, and now they just got hit with the requirement to provide health insurance, and that is hard for them to fit into their financial model. But they were required. And
they had more than 50 employees.
Yeah.
They had to get.
And that's difficult for a major, group of people in our country. And we need, in our district, we need to understand how many businesses are affected by that, because that shapes their thinking.
Yeah. Well, they had to pay something towards health insurance. Well, here's another one, just philosophical question. Why should employers pay anything for health insurance? Why is it the employer's job? What a screwed up system.
And we're the only country that does that.
Yeah, that's what people do. And there's a reason for that. And that's another reason to go to universal coverage. Then employers don't have to get health insurance for their employees.
What about the health provider systems, the hospitals? Are they lobbying one way or the other, or
they're down there on the lobby list. They spent $60 million this year lobbying. But as a whole, as a sector, the doctors and the providers do a real horrible job of lobbying. That's why they kind of end up at the bottom of the pecking order. That's why they've negotiated these horrible contracts with insurance companies. I remember I was in the business when these PPOs came into being, and these insurance people would come around and go, all right, we want you to charge us like almost nothing. We're going to pay you like really a little amount of money. Because we're going to, first we're going to squeeze on you, because we have, other people who do it for less. And, and these hospitals signed all these contracts 30 years ago. And that's probably been wrong. Well, you should have stood their ground, in a good way. But they're horrible negotiators. And doctors tend to not be great business people. Sorry, the doctors. So they don't have as much lobbying. Now, they had input into the Affordable Care Act, because, of course, there are a lot of people at the table for that. But I don't know what they're doing now. I don't know what's happening, because it's happening behind closed doors. I don't know. I don't even know what,
Wasn't it true that as fewer people have health insurance, a lot of rural hospitals would be shutting their doors?
Yeah, absolutely true. They're going to be hit the most. Yeah, and they are shutting their doors now as we speak. Because of this shrinking pool of insurance. That it's been to hospitals to have people walking in, and doctors have people coming up with almost everybody's insurance. They're getting ready to do great things.
So can you tell us 3 things that we should be doing?
Drinking wine
and drinking haven't mentioned already.
Don't get sick.
Yeah, drink and don't
We
get
all
sick.
stood there and we talked, to Fred, to everybody about the different things. We tried to report to
Fred's
why not,
pointless.
but we have to talk to
Right.
Fred or his replica up. And right now they're in control, so we have horrible things that are happening. So, we can call, we can do it. What is it that, do we have to wait for the bottom of the people that don't think that this is happening to them? Do we have to wait for them to see?
Well, you have to keep, we have to keep being very, very vocal. That does make a difference, even though it seems like they're not listening. It does make a difference, and they are scared of healthcare. They are scared. They know. The demonstrations about taking that Medicaid expansion away are why it's still there. That's why that didn't pass the House, and that's why this bill, this tax bill, is probably going to pass with the individual mandate out, because it doesn't affect Medicaid expansion. So, and here's the other thing, the individual market is not organized. Individual by, we're all scattered all over, we don't have a way, so it has to be people just screaming about what's happening to them and being forced to, and then the stories will come out of what's happening. I mean, next year it's not going to be pretty when people don't buy insurance and find out what that really means.
Mm-hmm.
And you have to blame that on her.
And you blame that. That is this premium. I want to be very clear. Remember that one graph I had where it showed the graph of the market had stabilized in July. And I read all these industry journals. The insurance companies were making money. They figured out their products. They were ready to hit the exchanges in the fall. And Trump pulled the rug out from under everybody intentionally to do just what he's done. So the premium increases in 2016 were adjustments to Obamacare, trying to get the markets, get the pricing right. Well, I could handle a 22% increase. I paid as an employer every year my premiums were up 10%. Every year. So I'm ready for 10, 15, 1 year, 20. But you can say unequivocally what is happening to this individual market is the result of Donald Trump and the Republican Congress. Mm-hmm. It is not the ACA marketplace. That's one thing you can say. Yes.
I want to raise a question about whether there might be a bright side if we have to live with the Republican Congress. Don't you think some groups, maybe some states, are going to figure out an alternative way to help people buy insurance or to be covered somehow?
Well, they really can't right now. The ACA would prohibit that.
Well, but if that goes by the wayside, don't you think there are some experiments going on that look maybe like this? I don't know.
Well, there might be isolation. I know that, some communities can put together some community health programs, and use their county taxes to put together county. There are things to be done like that, but again, that's for a certain segment.
These experiments by the states will largely consist of constructing new forms of what has been called junk health insurance.
Right.
These will be relatively low-cost policies that just don't cover very much, and that are pseudo-health insurance, not real health insurance, like the ACA was in its prime.
I want to get the whole idea of insurance out of it. Isn't that possible?
Well, there's a great, it's a kind of an oxymoron that we use private insurance to do health insurance funding, because the insurance companies have a vested interest in selling insurance to healthy people and not selling healthy insurance to sick people.
Right.
And they want to go back to those good old days when they do that.
Yeah, so the insurance companies are not our friends in all of this.
No, I know.
Andy has just mentioned Germany, where the insurance companies are in fact so highly regulated that they're really not making profits. If we had state insurance commissioners that were allowed to regulate in that way, we would be able to solve a lot of these problems. But we're a long way away from that. And let's point out that the problems with healthcare and health insurance are only one example of many where our culture in America is faced with a stalemate, a gridlock. You've got the people on the one side and the people on the other side. They can't agree, and they're roughly equal. It's like one of these arm wrestling things where the two sides are so equally matched that nothing is happening. That won't last forever. But what will break it, I don't really know. Ideally, rationality on the part of the citizens. But we've got a wonderful healthcare talk tonight and 16 warm bodies in the room out of the 155,000 people living in Berrien County. Good luck.
Oh, I just, I never see in any of these discussions, I never see dollar figures on what the cost to our country is for the people if we let all these people not be insured.
Well, it's out there somewhere.
Okay.
I could have put that in here, but did you want more bad news?
Well, I think that should
No,
be
the
in
cost
the
is out there.
equation though, because there's still
What
they
is
think
the
they're
cost?
saving everything and they're not. There's gonna be a huge cost.
Well, I mean, I
for-
can tell you that, Lakeland was on my Fred's doorstep, when he was trying to get rid of the ACHA. When he had the ACHA, the critical vote and getting that through the House, because there's an example of what happened.